Hello, everyone. Thanks for joining us. In this webinar, we'll be discussing building for maternal health equity and how we can address barriers for preventative care. So this event is being hosted by Aeroflow Breast Pumps. Aeroflow Breast Pumps is a division of Aeroflow Healthcare who's focused on helping individuals and families through their breastfeeding journey. We focus on conception to 1 year postpartum. And we are the personalized health partner that provides patients with easy to access integrated healthcare solutions that are covered by their insurance. So a little bit of information about Aeroflow. About 30% of all US births come through our doors, making us the largest singular aggregator of maternity patients in the US. About 85% of our patient base is covered for at least a portion of our solution, whether it be breast pumps, lactation services, mental health support. We have it covered. Through our relentless dedication to quality, we are proud to present that we have an 87% ease of use score, which we measure that by how easy is it to obtain services or products through our platform without having to pick up the phone. So we know that most of our patient population is Gen Z and millennials, so they tend to be heavily accessing their phone. So the fact that they don't have to place a call is beneficial to them. I'm joined today by some industry experts, so would love to have our panel introduce themselves. My name is Amanda Minami. I'm the moderator of the event, but would love to kick it off to the panel to have them introduce themselves, explain a little bit about who they are, what they've done, and why they're interested in health equity. And so with that, I'll kick it off to Kira.
Yes, I am Kira Walsh. I am a certified doula with DONA. Birth and postpartum doula, and then I'm also a certified lactation counselor, as well as a managed care associate here with Aeroflow. So specifically speaking today on the policy piece, and I will pass it off to Latice.
Hi, everyone. My name is Latice. I am a certified RN and IBCLC. Super passionate about this topic because there are so many health disparities among the BIPOC communities, and this is a great opportunity to increase access to impartial healthcare.
Hi,
Kelly.
Thanks, Latice. Hi, my name is Kelly Green. I am a speech language pathologist and international board certified lactation consultant. I particularly love working with populations that don't readily have access to the care and support that they need. And so this is a great opportunity to be able to shed light on the disparities and work together to create ideas and hopefully policies and solutions to help alleviate that disparity.
There we go. I am Sarah Law. I am a registered nurse as well as an IBCLC. I am passionate about this topic because I believe all moms and their babies deserve the best start in this journey. And we know that when moms get support and have access to all the care that they specifically need, and when we meet them where they are at, they are able to take care of themselves and then they can care for their baby.
Wonderful. Well, thank you all again for joining us. We invited them to join us to discuss an independent survey that was conducted earlier this year. It was a nationally representative survey where we looked at what factors impact maternal health and the outcomes that exist. So we looked at income, we looked at role, non-role, we looked at race. So given those results, we've asked the panel to really explore the barriers to care. So what we found was really interesting is maternal health, the largest gaps and the most focused interest from the nationally representative survey was focused in breastfeeding and mental health. We've also asked them to review integrated care models and how their role in supporting access, engagement, and effectiveness. And then we've also asked them to discuss policies and programs that have been considered, utilized, and proven to overcome those barriers. So kicking it off with breastfeeding, we know that inequities exist in breastfeeding. They're based on socioeconomic status, such as race and geography, and studies that have shown that women from lower households, marginalized communities, and certain ethnic or racial backgrounds are less likely to initiate and sustain breastfeeding. We saw that with the results too. 76% of the respondents indicated that tools, resources, and support related to breastfeeding and lactation were very important to them. But 1 in 3 said that it was difficult or somewhat difficult to access support. What was more interesting is that 0% of those that struggled were white. 13% identified as Asian, Black, or African American. And the most commonly cited challenges were lack of time due to childcare responsibilities, lack of finances, or the doctors did not explain or provide support. So to kick it off, Latice, obviously those results are really shocking. Can you explain more what kinds of barriers uniquely impact people of color when they consider breastfeeding?
Yeah, like you mentioned in the slide, I mean, it's not too shocking when you think about it. The lack of support and the education prenatally are big things that can impact, breastfeeding challenges as well. Many of the benefits or the things that can be beneficial with breastfeeding aren't really discussed prenatally with these patients. And so because they don't have that support team with their family members getting that discussion and getting that education prenatally, sometimes that can also end up leading to them not having that support after baby's here as well, because no one's educated. Like even with my sister, for example, she was the first person in her family to breastfeed and there was no support for her, but she did it on her own for a year. So if moms do decide to breastfeed and they don't have that equipped with that knowledge to offer that relevant help to sustain breastfeeding, of course, we're going to see them feel less supported and not have that support when they have those challenges to navigate through breastfeeding.
I would agree. And I guess there's still a policy piece to that. I don't know if Kira, having gone through the policies, working through the build out of this lactation support network, what are some unique policies that are in place that kind of perpetuate those siloed or that limited access that you've seen?
So the first thing that comes to mind is the scope of provider type that's required to provide these lactation services. Speaking similarly along the lines of Latice, that prenatal care especially we're seeing is very limited by provider type. Oftentimes you're seeing that it's required that the services are provided after birth in the hospital. So again, that's two barriers right there. Number one, after birth. Number two, in the hospital. So when I'm speaking to scope of provider type, I'm speaking specifically to the providers that are specialized in providing breastfeeding care, which is an IBCLC or a CLC. Again, if we're going to get more specific on, OBGYNs or nurse practitioners, those provider types are wonderful. They do great things, but they are not specialists in breastfeeding care and breastfeeding education. So again, those barriers being in the hospital and the scope of provider type.
Gotcha. And maybe Kelly or Sarah, do you have thoughts about what types of education is really beneficial to be as a preventative before baby's born that would really support the argument that prevention and before baby's born education is necessary?
Yeah, I think having both IBCLCs and CLCs are vastly important in being able to offer that prenatal education. Becoming an IBCLC is a feat. However, we need to be able to educate and to support these families. And so CLCs and others who have that lactation appropriate education to be able to offer to families is invaluable because it opens up the door and possibility. And we're talking about availability and access for more families to have the access to get this information, especially prenatally.
Wonderful. Awesome. And then Kira, can you share something about some policies that have done it really well, and what specifically have they done or allowed that has been beneficial for our patient base?
So Tennessee Medicaid is a great example of a plan that is doing it very well. They are not only allowing RN IBCLCs, but also IBCLCs and CLCs to practice within their network. And practicing within network is crucial to, again, increasing access to care, making it easier for patients to access that prenatal education and truly just have access, wherever they are, whether it's at home via telehealth. They're doing a great job with, like I said, allowing the specialists that, provide that breastfeeding education in network, which is key.
And maybe for those that don't know, what is that difference between the CLCs, the IBCLCs, and the doulas?
So I can speak on the doula piece.
Yeah.
So as a certified doula, again, I provide birth support as well as postpartum support. I am certified through DONA, which is the Doulas of International of North America. And what we do is we provide the birth support. So we're providing informational support, educational, and physical support for mom during birth, which provides greater birth outcomes, similarly to an IBCLC providing better breastfeeding outcomes. So that's what I do, supporting moms via birth. And then for postpartum, again, it's a lot of breastfeeding support as well as a CLC, providing that support for mom's maternal mental health. And if there are needs for further referrals, that's when I would pass it on to an IBCLC. So I will let one of the other ladies touch on what an IBCLC is.
Yeah, and maybe Kelly, I think you brought up the difference between the CLCs earlier. I would love to hear from you. What is a CLC? And I think you shared going on to become an IBCLC. What does that path look like for you?
So the main differences, and this is just to kind of piggyback what Kira was mentioning, is just a pathway to education. IBCLCs, it just is a more intensive certification process. There's some extra education that's involved. However, both CLCs and IBCLCs are both invaluable in being able to support, educate, advocate, and counsel. And so just kind of to speak into what Kira, if there is a situation in which there's maybe a more involved case, and potentially a CLC would then refer to an IBCLC just because of the extra potential credentialing or education involved. But again, having both available to families is going to greater open up your window to access.
Wonderful. Appreciate that clarification. So what we found was interesting as we continue down the survey result path is that 74% of respondents indicated that breastfeeding and lactation challenges impacted their mental health. Only 4% of moms actually said that there was no impact, and this was felt consistently across all subgroups. We were obviously surprised to see that lactation impacted mental health at such a high rate. Can you explain more about how this might have happened, Sarah or Latice?
Sure. I mean, moms in general, they have this preconceived idea of what it means to be a good parent and to give your child the best of everything. And oftentimes that could include successfully breastfeeding. And when they're not supported at home or by like their healthcare provider, where they're given an education on breastfeeding and how to overcome some of the challenges, they can tend to feel guilty or overwhelmed or inadequate when they're encountering these challenges without the support to help resolve them. And that can lead to earlier cessation of breastfeeding, as well as impacting their mental health as well. And we've also seen the opposite. When breastfeeding is going well, it helps improve their mental health. So it kind of goes into play in how interconnected that relationship can be.
So as we continued on into mental health, we obviously know that inadequate social support, challenges, and child care stress are all reliable predictors of maternal mental health conditions. We also know that Black and Hispanic mothers are 2 to 3 times more likely to experience a mental health condition and are far less likely to be diagnosed or treated. Untreated perinatal mood disorders lead to poor health, economic, and social outcomes for children. So when we got the results back, 90% of respondents indicated that access to tools, resources, and support related to mental health were very important or extremely important to them. But 1 in 2 indicated that it was very difficult or somewhat difficult to access support. 87% of those were rural moms, compared to the average of 78%, meaning rural patients had a more challenging time accessing support. American Indian, Alaskan Native, Asian, and Hispanic mothers reported the most difficulty in accessing support. And only 6% of Asian mothers said it was somewhat easy to get support. Again, there was no real trends across other subgroups, income level or otherwise. The most commonly cited challenges were lack of time due to childcare responsibilities, long wait times to see a mental health practitioner, or they did not know where to go. So since the results of mental health were felt across all subgroups, what do you make of that, Sarah?
Yeah, I think the thing is, you go into your OB appointment for the very first time when you're pregnant and you see this information of how important mental health is, and you see this information about how important breastfeeding is. So a lot of moms know the importance, but the access to the care when they need it at that time needs to be there. So, if mom has a newborn and can't leave her house or doesn't have somebody to watch that baby, or, maybe there's a 2-month wait to get into that mental health practitioner or that lactation specialist she needs to go to. Those are all barriers, and we're not meeting moms where they are at and kind of specializing care and helping them find the care that they need when they need it.
That's a great point. And we know that mental health is a key discussion. And I think we have to look at innovative ways to really support mom. What are some ways that lactation services, part of the Airflow Breast Pumps program, has implemented to really help support moms through those mental health struggles or barriers that they might be experiencing? I don't know, Latisse, if you have thoughts or feedback there.
Sure. Yeah, we have a course called the Brain Boob Connection, and that gives moms some insight on how their mind and their body's connected and how things like oxytocin and stress can impact their ability for their milk to let down. We also have our virtual consults where it gives us an opportunity to have that first point of access with some of our patients, and we can give them resources to like either postpartum support or even an app that we partner with to be able to help them improve their mood. And it's clinically proven to have success in that area. And we also can sometimes refer them to their healthcare providers as well. Now, in an ideal world, we would have some type of relationship with insurance companies where we have a directory where we can just send mom straight to someone to get the help that we need, especially if we see that they have a high score in their depression screening, and as well as having more emphasis on the depression screening as well beforehand to be able to give them that support that they need and not have to kind of pass them around to different providers and they don't know which one to get the help from. If we can just have a straight line to a provider, that will be a lot more beneficial for them.
And you mentioned the screening. What place of service does that usually happen? Like where do moms get screened for mood or anxiety disorders usually?
So it can be the OB, it can be the pediatrician's office. A lot of times, like when I have my kids, for example, the pediatrician's office are giving me a questionnaire and they're saying, how are you feeling lately? Are you feeling more sad than you normally do? Are you coping as well as you normally would? And then when we refer moms, sometimes we're referring them to the provider to see if they need some additional resources. But I don't know if the providers that the OBGYNs, for example, are actually trained in how to assist mom mentally or where to direct them to. So I think that's the gap there. It's like we can send you to your provider, your healthcare provider for, your OBGYN or your primary care physician, but do they know who you can go to next?
And I think that's this app that you referenced, right? There's an escalation point to the appropriate level of care. So I think that's fantastic. I think I've heard that you guys are also implementing a training program where you are able to also be able to have those discussions. Can you talk a little bit about that? Either Sarah or Kelly or Latisse, if you have it, yeah.
Yeah, I was going to say, so I am one of the people that was trained to do like perinatal mental health certification and having this knowledge of like trauma-informed care, because almost every patient comes to you with some type of trauma, whether it's life experiences or even systemic racism is considered a trauma as well. So emphasizing and individualizing their care is going to be very important, and knowing what these things may present as when you're talking to patients and kind of knowing that maybe we might need to dig into this a little bit more because maybe she's not coping as well as she may think, or maybe her family members may tell you things that she might not be able to recognize as well. So yeah, we are working on having people cross-trained to be able to identify and support moms a lot more specifically.
And it sounds like just creating more access to that support has been beneficial for you all. Kira, can you share a little bit more about what barriers have existed that prevented that integrated care model from really coming to fruition? I think we have a few that it works incredibly well, but can you talk about some of the gaps that prevent it?
Yeah, so again, going back to that scope of provider type, looking for that specialist that provides breastfeeding education, as well as telehealth. We're talking, this whole discussion is meeting mom where she is, right? So providing that access via telehealth, allowing her to not have to leave her house. So again, that eliminates that barrier there of looking for childcare. Long wait times. I know that with Lactation Link, moms can schedule and see a provider that same day. That could eliminate a barrier there. And then not knowing where to go, touching on, I think Latisse mentioned, getting in provider directories. By doing that, we create greater access to moms seeing, which providers they can see in network, not have to worry about paying extra money for deductibles, co-pays, all of the above. So really focusing on, scope of provider type, again, IBCLCs, CLCs are the true gold standard for breastfeeding education. And then allowing via telehealth is crucial in today's day and age. And also, making sure that mom doesn't have to leave her home. And it just makes it a lot easier for her to seek these services.
Great. Kind of along those lines, have you seen successful models that have worked really well?
Again, mentioning the with Tennessee Medicaid, they are the ones that come to mind specifically as far as a health plan that's doing it really well. They truly understand, the need for this type of care. They understand the differences in the provider types of why an IBCLC would quote unquote trump an OBGYN, for example, on providing breastfeeding care. Because of the scope of practice that an IBCLC or even a CLC has, the education that they have specific to breastfeeding, they truly do see that, and they see the gap in care of, where that's happening. So not only, again, are they allowing the specific specialist as an IBCLC or a CLC to provide that care, they're also allowing that to be via telehealth. So we're getting in those directories so the moms truly see, no matter what, what area they're in, they see, where they can see a provider that's close to them, again, via telehealth, not having to leave their house. They're doing a great job with truly closing those gaps.
Great. And so kind of rounding it out, I think we've addressed some of those barriers and discussed some of those solutions. And we talked about how some of those solutions could include creating more accessible points of care. Kira, more practically, what does that mean?
As far as the solution. So, again, it's just creating access literally from mom's phone. So she's able to get on her phone and see, what providers are near her, where she can seek care. And as far as closing the gap, we're providing that education prenatally. So not only is, mom, with her baby trying to breastfeed, she's stressed out and overwhelmed, and then seeking care and then having all of these barriers, and which, as you can imagine, might have her throw her hands in the air and say, this is just too difficult. We're addressing those issues prenatally and creating that access to care early so that we can have those more successful breastfeeding rates and see an improvement there in the mental health as well.
Gotcha. And Latice, would you have anything to add?
Yes. So doing virtual care and telehealth is a great option to get to a provider, right? But it isn't always about actually just getting to a provider. Sometimes access is the type of provider that you see, and having those diverse providers that have like that implicit bias training, and they're able to provide culturally competent care, and they're knowledgeable about mental health, how it presents in different cultures. So mom's able to get properly diagnosed and able to get the quality of care that they deserve. A lot of times moms are undiagnosed or misdiagnosed, and it may present differently. For example, anxiety in a Black woman may be different. It may present as anger, whereas in another, race, it may present as crying or being sad. So just kind of being aware of the cultural differences and how people present symptoms can allow moms to, one, be diagnosed properly, and then give that quality of care that they deserve.
Right. Awesome. Well, kind of as a conclusion question, I know we're talking a lot about prevention. What are some things that we can learn from population health approaches that really address some of these barriers? Sarah, is that one?
Yeah, I think the big thing with that is one size does not fit all when we're talking about population health in general. And when we're talking about moms, they're all coming from a different spot. They have different backgrounds, they've had different births, all these things kind of go into play. And so if we meet them where they are at and kind of specific care for that mom and the provider that she needs at that time, rather than 2 months later or not being able to see that provider, is really where we need to start with all of that so that we can support moms.
Well, thank you all. We'd love to kind of open the floor for questions. Sarah has been monitoring the chat, and I believe she's got some that she would like to send out to the team.
Yeah, so one of the things that we see here, so when we talked about the difference in a CLC and an IBCLC and a doula, can you all go over the differences in the types of services specifically that they provide and how they uniquely are different?
So I can again touch on the doula piece. So as a certified doula, again, I'm providing that support in postpartum, birth and postpartum. So what that looks like is me, mom goes into labor. I typically get that call. I go with her to the, hospital, birth center, home, wherever she's choosing to have her birth. And I'm providing informational support. So if, an intervention is suggested, I'm offering educational support with that, helping her physically through her birth as well. So really just truly allowing her to feel heard and supported in birth, which, as we know, can lead to greater breastfeeding success rates, and then well into postpartum as well. So again, as a CLC, that looks like helping with breastfeeding. Again, if there is a need for a referral to an IBCLC, that takes place, but also just making sure that mom's mental health is where it needs to be in postpartum. As we know, postpartum emotions are a roller coaster. So just truly making sure that mom, again, feels heard and supported throughout her postpartum experience.
Great. Thank you. Robin also mentioned here that some cultures do not address mental health, or that it's stigmatized, so they do not as a whole get help for mental health. In your experience, obviously in the industry, have you seen that as well? And just kind of speak to that a little bit.
Letice, is that one you can?
Yes, so I have seen it, right? Like, it's just not a conversation that's really had in certain cultures, especially ones where you are used to having to be strong or tough. Then you don't want to show any signs of weakness. And unfortunately, the way that mental health is stigmatized, it's seen as a weakness. It's seen that you just can't cope with what everyone else can potentially be able to cope with. And so that barrier alone, or that guilt that you may feel, or that shame that you may feel, even having these symptoms and knowing that something's just not right, can still also be a barrier for you seeking that help. And when I say you, I mean like a lot of the BIPOC community in general. There is really stigmatized. So when you go to a provider, for example, and the provider is not culturally competent, doesn't ask you those further follow-up questions to see how you're really feeling, instead of just sometimes, checking a box, whereas those symptoms aren't really discussed. And if they aren't brought up or asked about, they probably aren't going to be offered up either. So that definitely is something that having those providers that are trained to understand and recognize without directly being told that someone's feeling these things is also going to be beneficial for these moms getting diagnosed and getting the help they need.
And I love the fact that they acknowledge the person who asked the question, that there is a stigma sometimes with going to a certain provider. And I think that blends well with what Letice had shared earlier about going through that training kind of as an addition to. So it's another provider type that is trained in it, that is operating as a lactation provider, providing lactation support, but also has this mental health training and can assist and escalate as necessary.
Okay, and the last one here that we have, obviously you shared a lot about the policies that prevent access. And Kira, I know you spoke a little bit too about examples of plans that have created great access, but we got a question asking, were there any other plans that also created great access through their practices aside from Tennessee Medicaid that you've seen?
Offhand, again, I'm not really sure of plans specifically by name. Again, it's a lot of the MCOs with Tennessee Medicaid. There are other plans that are doing it very well. And by doing it very well, like I said, what that looks like is looking specifically for the provider type of IBCLC, not requiring an additional credential like an OBGYN or nurse practitioner. And again, allowing it via telehealth. Those two, things right there, the scope of provider as well as telehealth eliminate so many barriers, and allowing it preventatively as well. So that's a third one. Truly just create a greater access for moms to access the care. So again, they're getting that education prenatally, which means that they know kind of, what to look for, signs to look for, especially when it comes to mental health. As Letice mentioned, they're being trained in this additional certification. So not only are they lactation consultants, but they're also trauma-informed lactation consultants. So they're truly able to educate and look for those signs and let moms know what to kind of look out for. So again, as far as eliminating barriers, that again is scope of provider being IBCLC or CLC, allowing it via telehealth, and then also offering it preventatively as well.
If I can just piggyback off of that, I think some of the plans that offer the unlimited number of visits and consults and classes are also very supportive, because some of the things that moms are struggling with can be resolved in a one-on-one consult. If the latch is causing her to have mental health stressors or putting her more at risk of depression, and having the ability to not worry if, oh, I only have one more consultation left. I need to make sure I save this one until 2 weeks. Like taking that off of their mind and being able to know that I can actually seek help as much as I need to until I land to a place where I'm confident and comfortable can also be really helpful. So the plans that offer those unlimited services, like hats off to you, because I've seen firsthand how it benefits these moms in reducing the stress and having to pick and choose which classes they anticipate they may need.
And I think you mentioned some really interesting pieces there. When you talk about classes and one-on-one consults, can you explain why those two are really important to a patient?
Well, having those unlimited numbers, right? In the beginning, that means you can take any of the classes prenatally that you want to. So you're getting all that education when it comes to whether it's pumping or just general breastfeeding prep, or knowing what things are common, like maybe engorgement for the first 2 to 4 days is common. How do you piggyback off of that? How do you fix that? Like these are all taught in classes, and then you can take it one step further if you need to on a one-on-one basis for a more individualized situation. But having that education prenatally, virtually, right, in a group setting, or if you choose to do it in a private setting, is going to put you one leg up when postpartum comes and you're like, oh, okay, I heard about this. I've heard this like 3 or 4 times before. Or even postpartum, if you've forgotten some things and you have the ability to take a class a second time, you get that information reinforced and you feel more empowered and you know what's normal and where to seek help if there's something that's not normal.
That's a great point, because I think based on your conversation, it sounds like when visits are capped, perhaps those that are in the most need are really left without the best support. No, that's wonderful. Out of curiosity, having been in the industry as experts, what is some of the more shocking information that you've come across? I don't know if each of you could share a story, just a common misconception that you may have heard. Would love to hear kind of the stories from the patients that you've been able to service. So I don't know if Kelly, if you want to kick it off.
I often hear and have to just kind of dispel the myth that breastfeeding hurts and that it should hurt. I'll have some moms that kind of are, we're in appointments together and it's almost like they feel like this pain should be a rite of passage into breastfeeding. And, just peeling back the layers on that and kind of going over why it shouldn't hurt and what happens when it does hurt. And again, usually these are moms who didn't have that education beforehand. They're holding on to these myths and these ideas that have kind of been, swirling social media, swirling kind of just society, from lack of prenatal breastfeeding education. So for me, that's a huge one that I like to kind of go over with families, and that it shouldn't hurt, and being able to offer the help and support that they need to navigate that.
That's a great point. And then Kira?
So one of the biggest ones that I encounter is that a breast milk supply should be a lot more than it is. I think social media perpetuates this a lot, where you'll see a mom with a natural oversupply, and that might look like 8, 10, 12 ounces pumping per session, where in reality, that's not, the standard normal amount that a mom should be pumping per session. So I think, again, touching on what Kelly said, a lot of it is, moms don't have that prenatal education. So they get on social media, they search hashtags like, milk supply or how to increase milk supply. And then they feel those feelings of guilt, shame, embarrassment for not having a supply that looks like what they're seeing on TikTok, Instagram, Facebook. So just truly understanding what a healthy milk supply looks like is crucial to successful breastfeeding.
And Letice?
I hear that like breastfeeding, because it's natural, right? It should be easy. Like that's one of the biggest ones. So when moms experience challenges, they're like, something's wrong with me or something's wrong with my baby. This isn't going to work. And it's like, no, breastfeeding is, yes, it's natural. Putting baby in the breast, okay, biologically normal, right? But it's not always easy. There's some things that you may encounter that's part of the process, and your journey doesn't have to look like someone else's journey. And in the movies, babies come out and they latch right away, and that's the movie, right? But in real life, sometimes babies need a little bit of help, a little bit of adjustment. And it doesn't mean that anything's wrong with either one of you. You just need some additional support.
And then Sarah.
Yeah, I think a huge one, especially when I was working in the hospital in that postpartum unit, was moms thinking that their milk wasn't in yet and that their milk wasn't going to come in until day 3, 4, 5. And it was so relieving to so many moms to hear your body's been making colostrum since you were, like 16, 18 weeks pregnant. So your body knows that baby needs to eat and it's got food ready for that baby. And again, if they had that prenatal support and education, so many moms would feel confident going to the hospital knowing my baby's going to have food when they're born. So I think that one's a huge one.
Great. Awesome. Well, thank you all for sharing your stories and sharing the feedback. And we appreciate everybody that was able to attend. We will be sending out this presentation following the call. So if you have any questions for Aeroflow or any member of our team, please don't hesitate to let us know or respond to the email, and we'll be happy to get back with you. Thanks, everyone.